I'm Victoria Carrick. I'm a consultant clinical psychologist working in the NHS. So I've been speaking about my career, my route into the career, a little bit about the fact that I attended Ryburn myself, and also what a typical day looks like as a clinical psychologist working in the NHS. I went through a few different iterations of what I thought I wanted to do as my career. I think while I was here, I thought I wanted to be a sports teacher. Then probably by sixth form, I think I wanted to do marketing and business. And a sort of savvy route into that at the time was to study psychology. So originally, when I first filled in my sort of UCAS forms and things, I was applying for psychology courses, thinking about a route into business really, and having something unique on my CV. And then sort of as I progressed to upper sixth, started doing some more work and voluntary work that within more of a caring setting, and started to get the bug really for kind of thinking that I wanted to work with people. And yeah, once I'd gone to university, then it became more and more apparent to me from careers talks and guest speakers that really interested me. And so partway through my first year, really switched my focus. Oh, so it's quite varied. As a consultant clinical psychologist, I probably do a little bit more indirect work than direct work now. So in my earlier career, it was lots and lots of one-to-one work with patients, doing assessments, formulations, or what we really is an understanding of the difficulties that they might be having at the current time, and then some therapy work. But now I do have a caseload and still do some of that work, but actually a lot of my work is in supporting other psychologists that are working in the health setting and in the hospital, and in teaching and training. So I do a lot of work teaching other psychological professionals and in supporting those working in the field, so nurses and medics. I think I am a people person, so I absolutely love meeting new people, mixing with lots of different people from all over the country. We're especially centre where I work in Manchester, so we see people from all over with really rich stories, really rich experiences, and yeah, I think I'm a real person that loves having a good chat and getting to know people and feeling like I'm supporting somebody and helping them. I think, again, just lots and lots of experiences. I was always quite sporty at Ryburn, so again, that teamwork, mixing with lots of different people, you know, with the big year groups, there's lots of forms, so you get to know a lot of people, again, lots of people with different experiences than perhaps yourself, and I think, yeah, just really getting those opportunities to mix. And I can remember, gosh, I don't know what year we would have been, maybe 10 or 11, we got to do some voluntary work in the community. We went to a nursing home nearby, again, just getting those experiences to see what caring professions were like really, and starting to recognise that that was a sort of area of interest and that maybe a skill that I possessed. So yeah, just really valued my time here and the experiences that I got. I would say definitely start to have a think about it and a look around it now. Start to read around. I'd never heard of a psychologist when I was at Ryburn. I didn't really know what psychology was or what the diverse fields psychology can contribute to were until certainly sort of into sixth form and later sixth. So I think have a look. There's really good information on the websites. If you look at the NHS and have a look at clinical psychology, if you look at the British Psychological Society, lots of information because psychologists work in lots of settings: forensics, paediatrics, which is working with children, sports psychology, clinical health like myself. So yeah, have a look, but psychology can also lead into and benefit you for other careers, as I said, business being one of those.